Gastroenteritis. Definition: gastroenteritis is inflammation of the lining of the stomach and small and large intestines. Most cases are infectious, although gastroenteritis may occur after ingestion of drugs and chemical toxins, e.g., metals, plant substances. Acquisition may be foodborne, waterborne, or via person-to-person spread. Gastroenteritis, also known as infectious diarrhea, is inflammation of the gastrointestinal tract, the stomach and small. Risk factors. The people most at risk of gastroenteritis are infants and young children, who have an immature immune system; the elderly, who have less efficient immune systems, and especially those living in nursing homes; children in daycare, school children and students living in dormitories; anyone with a weakened immune system, such as people with HIV/AIDS or receiving chemotherapy. Travelers. Cause: viral. Rotavirus is the most common cause of gastroenteritis in children, and produces about 70% of episodes of infectious diarrhea in the pediatric age group. Rotavirus is a less common cause in adults due to acquired immunity. Norovirus is the cause in about 18% of all cases. Incubation is 1 to 3 days. Norovirus is the leading cause of gastroenteritis among adults, causing greater than 90% of outbreaks. People may remain infectious even after their diarrhea has ended. Norovirus is the cause of about 10% of cases in children. Incubation is 24 to 48 hours. Astrovirus can infect people of all ages but usually infects infants and young children. Infection is most common in winter. Transmission is by the fecal-oral route. Incubation is 3 to 4 days. Adenoviruses are the fourth most common cause of childhood viral gastroenteritis. Infections occur year-round, with a slight increase in summer. Children, 2 years, are primarily affected. Transmission is by the fecal-oral route. Incubation is 3 to 10 days. Bacterial. Escherichia coli, Salmonella typhi, Shigella, Campylobacter species, cholera, toxigenic Clostridium difficile, Staphylococcus aureus. Acid-suppressing medication appears to increase the risk of significant infection after exposure to a number of organisms, including Clostridium difficile, Salmonella, and Campylobacter species. Parasitic. Giardia lamblia, Entamoeba histolytica, Cryptosporidium species. Non-infectious. There are a number of non-infectious causes of inflammation of the gastrointestinal tract. Some of the more common include medications, like NSAIDs, plant substances, certain foods such as lactose, in those who are intolerant, and gluten, in those with celiac disease. Crohn's disease is also a non-infectious source of, often severe, gastroenteritis. Transmission. Transmission may occur from drinking contaminated water or when people share personal objects. Water quality typically worsens during the rainy season and outbreaks are more common at this time. In areas with 4 seasons, infections are more common in the winter. Worldwide, bottle feeding of babies with improperly sanitized bottles is a significant cause. Transmission rates are also related to poor hygiene, especially among children, in crowded households, and in those with poor nutritional status. Pathophysiology. Signs and symptoms. Diarrhea, nausea and vomiting, abdominal pain and cramping, mild fever and chills, loss of appetite, headache and muscle aches, tiredness and general body weakness, incontinence, loss of control over bowel motions, poor feeding in infants. Dehydration can arise from the excessive loss of fluid from the body, which can occur quickly with gastroenteritis. The signs and symptoms of dehydration include extreme thirst, not having urinated in the past 8 hours or passing only a small volume of urine, urine that is dark in color and smelly, dry lips and mouth, and a lack of tears, cold hands and feet, sunken cheeks or eyes, dizziness, lethargy, floppiness. In infants, dry nappies, for longer than 4 to 6 hours, and or a sunken fontanelle, the soft spot on the top of a baby's head. Skin that tense up when pinched. Diagnosis. History taking. Physical examination. Stool cultures. Complete blood count. Serum glucose. Serum electrolytes. Kidney function. Management. Rehydration. The primary treatment of gastroenteritis in both children and adults is rehydration. This is preferably achieved by drinking rehydration solution, although intravenous delivery may be required if there is a decreased level of consciousness or if dehydration is severe. Dietary. It is recommended that breastfed infants continue to be nursed in the usual fashion, and that formula-fed infants continue their formula immediately after rehydration with oat. Some probiotics have been shown to be beneficial in reducing both the duration of illness and the frequency of stools. Antiemetics. Ondansetron. Metoclopramide. Dimenhydrinate. Antibiotics. Macrolide, such as azithromycin. Fluoroquinolone. Ciprofloxacin. Norfloxacin. Metronidazole. Vancomycin. Tinidazole. Antimotility agent. Loperamide, an opioid analog, is commonly used for the symptomatic treatment of diarrhea. Bismuth subsalicylate, an insoluble complex of trivalent bismuth and salicylate, can be used in mild to moderate cases. Nursing management. Nursing assessment. Assess stool characteristics. History of bowel patterns and the onset of diarrheal stools, with details on number and type of stools per day. Suggest terms to describe the color and odor of stools to assist the caregiver with descriptions. Assess for vomiting. Inquire about recent nausea and vomiting. Assess for presence of illness. Ask about fever and other signs of illness in the client and signs of illness in any other family members. Physical examination. The physical exam of the client includes observation of skin turgor and condition, including excoriated diaper area, temperature, anterior fontanelle, apical pulse rate, stools, irritability, lethargy, vomiting, urine, lips and mucous membranes of the mouth, eyes, and any notable physical signs. Nursing diagnosis. Diarrhea related to GI infection. Deficient knowledge related to disease. Risk for fluid volume deficit related to diarrhea and vomiting. Imbalanced nutrition, less than body requirements related to indigestion, diarrhea and vomiting. Anxiety related to hospitalization, economical burden. Fear related to loss of life. Hyperthermia related to infectious process. Nursing care planning and goals. Control of diarrhea. Minimize the risk for infection. Maintain good skin condition. Improve hydration and nutritional intake. Eliminate the risk of infection transmission. Nursing interventions. Plan care to allow uninterrupted rest periods for the patient. If the patient is nauseated, advise him to avoid quick movements, which can increase the severity of nausea. If the patient can tolerate oral fluids, replace lost fluids and electrolytes with broth, ginger, ale, and lemonade, as tolerated. If dehydration occurs, administer oral and IV fluids as ordered. To ease anal irritation caused by diarrhea, clean the area carefully and apply repellent cream, such as petroleum jelly. Wash hand thoroughly after giving care to avoid spreading of infection, and use standard precaution whenever handling vomitus or stools. Monitor the patient's fluids status carefully. Assess vital signs at least every 4 hours, weigh him daily, and record intake and output. Teach the patient about gastroenteritis, describing its symptoms and varied causes. Teach the patient the proper preventive measures. Evaluation. Goals are met as evidenced by control of diarrhea, minimized risk for infection, maintain good skin condition, improved hydration and nutritional intake, satisfied sucking needs in the infant, eliminated risk of infection transmission, complication, dehydration, malabsorption, shock, transient lactose intolerance, systemic infection, meningitis, arthritis, pneumonia, especially with salmonella infections.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.